Hello, lovely people. My name is Christiana Mausi Sarah, and I'm a public health practitioner. Today, I would like to talk about some health tips for women who are in their menopause or women who are transitioning into this phase of womanhood. In my previous videos, I talked about what menopause is, at what age it starts, that's between 45 to 55 years. I also talked about the various signs that a woman will see or experience that will show that she is in her menopause. Okay, and some of these signs include cessation of period. The woman does not menstruate anymore. She does not ovulate anymore, and the woman is likely to have increased cholesterol due to reduced estrogen, because estrogen helps with breaking down the cholesterol in the liver. That's cholesterol metabolism. And then the woman will experience dryness of the hair, brittle hair, dry skin. She could also experience hot flashes, which is due to reduction or hormonal changes during menopause, and so many other signs. So today, I want to focus on some health tips that a woman who is in her menopause or who is starting her menopause can use, to help her adjust with the new phase of womanhood, which is menopause. So the first one is what? Eating more vegetables and fruits. If you remember, in my previous videos, I mentioned that estrogen helps with fat distribution in the body. And during menopause, because estrogen level is reduced, you are likely to gain fat around your abdomen and other areas, other undesirable areas. And gaining more fat also increases your risk of developing cardiovascular diseases such as hypertension and other heart diseases. So you want to control how you eat, fatty food, high fatty food. You want to avoid foods that are high in fat. For example, fried rice, all the fast foods. You want to stay off them, stay away from the fast foods as much as possible. You want to eat more of vegetables and fruits. At least try and take at least 3 servings of vegetables and fruits in a week. And make sure you want to eat, if you are going to buy milk, for example, you want to choose milk that is low in fats, the fat level is low, or skimmed milk. That way you are controlling the amount of fat that you take in. You don't want your body to build up a lot of cholesterol, because that will give you problem. Then the next health tip is to, I've stated that already, reducing or avoiding high fatty foods. So stay away from all the fried foods. And interestingly, it's very important, once you hit age 40, you should avoid fried foods, the bofros, the fried yam, fried this, fried egg, fried that. You want to adopt other methods of cooking instead of the frying. So, for example, when it comes to fried chicken, you want to opt for grilled chicken or roasted chicken instead of the deep fried chicken, just to make sure you are keeping your cholesterol level in check. The next point is to consume foods that are high in calcium and vitamin D. Why do you need to eat more foods that are high in calcium and vitamin D during menopause? Well, during menopause, here again, reduced estrogen leads to sudden loss of a lot of bone mass. So your bones become porous, they become brittle. You could easily get fractured. So around this time, you need to take in more foods that are high in calcium, because calcium helps you to build your bones, and vitamin D is necessary for the body to absorb calcium. So vitamin D helps your body to absorb the calcium. That is why the two move together. So let's look at some examples of foods that are high in calcium. We have milk, and please choose low fat milk or skimmed milk, of course. Then we have cheese, choose low fat cheese. We have yogurt, please opt for low fat yogurt. And we have sesame seeds. We have green leafy vegetables like kontomire, as we have here in Ghana, kontomire. We have boma, we have ademe or ayoyo. All these green leafy vegetables. We have cabbage. They are all good and high in calcium. Then when we look at foods that are high in vitamin D, we have fish. Typical example of fish that is high in vitamin D is tuna, and we also have mackerel. Those fishes are high in vitamin D. Then we also have foods that are fortified with vitamin D. For example, we have cereals that have been fortified. Fortified means they've added vitamin D to the food, the processed food. But here again, you also want to control the intake of processed foods. But once a while, foods that are high, that are fortified with vitamin D is fine to take. Then you can also take almond milk. Almond milk is also very high in vitamin D. We have, and another example of the fortified food is the orange juice. Some orange juices have vitamin D added to them. And cereals, so those are the examples. And we have many more. So please focus more on that instead of taking, calcium supplements and prescribed calcium supplements. Here is a caution. You are likely to feel, instead of taking these foods, why not just go to the pharmacy and buy the calcium and vitamin D supplements? Excess intake of calcium supplements can result in the formation of what? Kidney stones. And I know you don't want to go through that. Kidney stones are commonly made up of calcium and oxalate. So you want to, if you feel like taking calcium supplement, please discuss with your physician, discuss with your doctor, so that the doctor will determine if indeed it's okay for you to take, and the quantity you should take, the dosage you should take, and all that. So don't just be on calcium supplement forever. Please do not do that. You will be harming your kidneys. Okay, so the next health tip is for you to drink more water. Remember, I mentioned there is increased risk of developing urinary tract infection during menopause because of thinning of the vagina wall, and then also because naturally, as you age, as you hit 40, from 40, the pH or the acidity of the vagina, the acidity in the vagina goes down. So in this case, your pH increases, so it becomes more basic, and then it allows microorganisms to thrive and cause infection there. So drink more water so that you can urinate and flush out any microorganism that may be sitting in your bladder or your urethra, which can cause infection. Also, around age 45 going, your bladder is not able to empty completely. So there is always residual urine after you have finished urinating. So you want to take more water so that you can clear any urine, any microorganism that may be in that residual urine. So you can flush out any of those by taking frequent water. So somebody will say, so how should I drink water? When you wake up in the morning, at least take 2 glasses of water. And a glass is 250 ml. So at least take 500 ml of water. And here in Ghana, that is equal to 1 sachet of water, or the 500 ml bottle water. Yes, take that in the morning when you wake up. When you also take it after breakfast, you take it before lunch, after lunch, before dinner. But in the evening, make sure you do not take a lot of water 2 to 3 hours before going to bed, because that could disturb your sleep pattern. You will have to wake up to urinate. And already, as mentioned earlier, there is what sleep disturbance. There's change in your sleep pattern due to the hormonal changes. So it's very important not to do anything that will, further worsen your sleeping pattern. And then to improve your sleeping pattern too, you can also drink hot chocolate beverage. Hot chocolate, make some hot chocolate and drink before you go to bed. It relaxes you, and then it enables you to sleep well. You can also take a warm bath before you go to bed. That also relaxes you and helps you to sleep. And then just listen to some cool music to relax yourself so that you just fall asleep. Okay, so the next health tip is for you to what? Do certain lab tests. The first lab test you should do is what? To check your fasting blood sugar level. Fasting blood sugar level, which is also called FBS. It's very important to know whether your blood sugar level is getting out of control, or you are nearing diabetes and so forth. So it's very important to check your fasting blood sugar. And usually before you go to the lab, for example, if you intend to go to the lab tomorrow to check your fasting blood sugar level, your last meal should be at least 8 hours from the time that you check the fasting blood sugar. And the best times to check fasting blood sugar is from 7 a.m. to 8 a.m. in the morning. So once you eat, let's say if you eat in the night, your last meal is 7 p.m. sorry. So at least do not snack in midnight, or by 11 p.m. you shouldn't be chewing on food again. You should go to bed and rest so that in the morning you can check your blood sugar level. And the normal fasting blood sugar level should be between 3.9 to 5.6 millimoles of liters. So if you check your blood sugar level and it's between 5.6 to 6.9 millimoles of liter, then you should know that you have to monitor it more, and then also make some changes in your eating pattern, start exercising and all that. Because once your sugar level, your fasting blood sugar gets to 7 millimole of liter, then you are diagnosed as being diabetic, and you do not want to go through that stress. So check your fasting blood sugar at least twice a month. So every 2 weeks, at least twice a month, so that you know your normal fasting blood sugar. So if there is any deviation from normal, you quickly go to the health facility and see your doctor for assistance. Then the next lab test is what? You check your lipid profile. Or some people will say check your cholesterol. I mentioned earlier that estrogen helps with what? Cholesterol metabolism, or breakdown of cholesterol in the liver. So you do not want to, as you are entering menopause and estrogen level is reducing, you want to monitor your cholesterol level to make sure your LDL level, that's the bad fat, that's the low density lipoprotein level, is low, and then the high density lipoprotein is high, that's the good fat. So you want to keep checking that, and then adjusting your lifestyle to make sure you do not develop any cardiovascular disease and so forth. Then the next thing you should monitor, this one is not a lab test, is your blood pressure. Monitor your blood pressure at least twice a week, so that you will know your normal BP. So if there is any increase or drop, you will know. So please try and check your BP, monitor your blood pressure. And any blood pressure that is 140/90 or more millimeters of mercury is diagnosed as hypertension. Average normal BP for an adult is 120/80 millimeters of mercury. There are people who have slightly lower, blood pressure. For example, 110/80. That is why you need to know your normal BP. so that if there is an increase, you are able to tell. Okay. Then the next test you should also consider is what? Breast exam, specifically mammogram. Mammogram is just like an x-ray of the breast to look inside the breast to see whether there is any cancer tissue or cancer cells developing in your breast. So mammogram normally, or it's recommended that you do your first mammogram around age 40 or at age 40. But if you haven't done that, once you've entered menopause, it's just good to do it. And please note, I'm not trying to say that menopause causes cancer. However, the fact that you are growing older, that alone increases your risk of developing any cancer, any form of cancer. When it comes to breast cancer, if you are in your menopause and you've been put on a hormone replacement therapy, due to the symptoms, hot flashes and all that, some women are put on low doses of estrogen, progestin, combination pills, just to help them cope with the changes or the signs that are occurring due to the menopause. So if you are on estrogen, that's hormone replacement therapy, it increases your risk of developing breast cancer. Same way, if you experience your menopause, if your menopause starts after 55 years, that is late menopause, it also increases your risk of developing breast cancer. So somebody will say, why? In the two circumstances, late menopause and then being on hormone replacement therapy, the woman is exposed to what? More estrogen. And please note that the longer you are exposed to estrogen, so the more you are having your periods. You know, estrogen controls your menstrual cycle. So the more you are having your periods, the more you are exposed to estrogen, and your risk for developing breast cancer also increases. Estrogen stimulates the tissues in your uterus and your breast, so it helps your breast to develop. So the more you are exposed to estrogen, it's likely what? It could lead to what? Cancer. And cancer is simply what? When the normal cell growth becomes out of control. Yeah. So if you start your menopause late, that's after 55, or you are in your menopause already and you've been put on hormone replacement therapy, it increases your chance of getting breast cancer. So please get your mammogram done. Okay. Then the next test is what? Pap smear or pap test. And this test is done to check whether a woman has or is at risk of developing cervical cancer, or she already has what? The cervical cancer. The human papilloma virus, that's the HPV, is the virus that causes cervical cancer. And this virus can be contracted through unprotected sex with an infected partner. So if a woman is exposed to this virus through unprotected sex, by the time she is 40 or 30 something plus, if she was exposed earlier, there are high chances that what? The virus would have caused some changes in the cells around your cervix. So this test is not painful, it's painless. So the doctor will just insert a brush, soft brush, to brush the tip of your cervix, around your cervix, just to see and then it will be sent to the lab and examined to see whether there are changes, abnormalities in the cells of your cervix. And when it comes to cancer and any other medical condition, the earlier the person is diagnosed, the better the prognosis and the outcome. Early treatment saves life. So it's very important. And for pap smear, even if you have not reached your menopause yet, once you are sexually active, you should have your pap test done. And it can be done in women as young as 21 years. So you do your pap test at age 21. If it's negative, meaning there is no HPV, there are no changes in your cervix, then you can do the test after every 3 years. Women who are 30 and above should also do it. When it comes to cervical cancer, the average age at which most people are diagnosed is around 50 years. So you see why it's important to do this test once you've entered menopause, because that is around the age where the cancer shows up. So once it's picked up early, it will be treated, and then you have your normal life back. And cervical cancer is very common among women who are between 35 and 44. The risk is very high in those years. So please continue to have unprotected sex if you are sexually active, and make sure you get tested for HPV and then the pap test as well. Okay, so please consider those tests. They are very important. The next health tip you should consider is to avoid stress, or to control your stress level. Once you are stressed, it throws your body up into so many chaos. Your hormones are over the board, everything. Your BP will go up and you can't sleep well. So please try to have enough rest. Try and avoid stress. If you have work to do, it will be good to spread them over, so you don't stress yourself trying to finish everything just at a go. The last point for this video is for you to monitor your weight. Please monitor your weight. Remember, I talked about estrogen and its assistance or its help in fat distribution and all that. So now that you are entering menopause, you need to monitor your weight, and if your weight is increasing and all that, you want to change your lifestyle to make your weight come back to normal. Because once you gain excess weight within a short time, it increases your risk of developing so many health conditions: diabetes, hypertension, heart failure, and so many things. So you want to be very cautious. Okay, so in my next video, I will talk about more of the health tips for women who are in their menopause. So thank you, and please look out for the next video, the part 2 of this video. Thank you.